Look, if you're looking to overcome depression, defeat headaches, improve sexual function, improve muscle recovery after workouts, you're not going to want to miss today's show. I'm going to be talking about therapeutic amino acids that your doctor will never tell you about. Stay tuned. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's zone. Today we're going to be talking about therapeutic amino acids for several different reasons. Number one, many of these amino acids, when taken in doses high enough, have tremendous benefits and impacts on your health. Many of the symptoms that simple amino acids can help you with are commonly medicated with very strong and very potent drugs that have additional side effects. Number two, there's a war right now going on against eating animal meats. And animal meats are the most viable way to get these essential and non-essential amino acids in your diet in meaningful amounts. And so again, that trend of moving away to moving toward plant-based diets, moving away from animal meats, in my opinion, is a dangerous trend to universally set upon all people. But let's talk about these amino acids so that you can understand, no matter what kind of diet you're on, whether you're carnivore, whether you're vegan, whether you're no grain, no pain diet, doesn't matter. You want to make sure you understand what these particular amino acids can do for your health. So let's dive in. We're going to be talking first about an amino acid called NAC, N-acetylcysteine. Now, NAC was really popular the last few years because of its tremendous immune effects. So NAC helps with the immune system. It helps with different types of common colds and other viruses. NAC is a primary driver for the production of something called glutathione. Now, glutathione is a compound that your body produces. NAC is the rate-limiting ingredient. So it's one of the main ingredients that goes into generating glutathione. When we think about what glutathione does, its primary role is to aid the liver in the detoxification of environmental pollutants and toxicants. And so when you don't have adequate glutathione, your liver basically can't do its functionality as well, cannot detoxify as well. This can increase the body's burden and therefore can increase the risk of developing things like chronic degenerative inflammatory diseases, autoimmune conditions. So the body needs to be able to produce glutathione. And the problem with today's world is we're so overwhelmed with pollutants in the environment. So we've got things in the air. You know, you've got pollutants in the water, you've got a number of chemical compounds and additives, preservatives, pesticides, and other things in the food. Well, for all of these things you're being exposed to, you need glutathione to be able to break those down and excrete them out of your body safely. And you're not going to be able to adequately regenerate or supply the body with glutathione if you don't have enough N-acetylcysteine or cysteine as an amino acid. Again, very, very critical, very, very important. Now, one of its other major roles is in its properties as what's known as mucolytic. Now, mucolytic means that it breaks down mucus. So those of you that struggle with any kind of chronic obstructive pulmonary issue, you know, asthma, emphysema, if you've got a cold or a flu and you've got heavy, heavy mucus in your lungs or heavy, heavy sinus congestion, this makes N-acetylcysteine NAC, its mucolytic power is unmatched by anything else. And this is a very, very powerful amino acid, meaning that you can go over to the drugstore and you can buy a number of over-the-counter remedies, you know, for sinus congestion and for fluid retention in the lung, etc. But NAC works better and it's natural and there aren't really any side effects. And so there's no untoward other fillers or other ingredients. If you buy just a pure NAC, you're getting very, very powerful mucolytic without any downstream side effects that you wouldn't want. And again, a lot of people, when they have that congestion, when they have that excessive mucus, one of the things they gravitate toward more than anything else, and doctors a lot of times will prescribe steroids. And then of course, steroids are anti-inflammatory. They can help with that mucus production, but they deplete vitamin D and calcium, they deplete magnesium, and they deplete vitamin C. And so if you think about, the consequences of causing these nutritional deficiencies when we're trying to resolve an immune issue, and these nutrients are necessary for healthy immune function, you can see why steroids may not be as good of a choice as N-acetylcysteine, as NAC. So again, it offers a natural way to break mucus down and to improve upon immune support and function, but also a natural way to help with detoxification. So in my opinion, one of the biggest powerhouse amino acids therapeutically is N-acetylcysteine. Now, how much should a person take if say we're trying to get a mucolytic effect? If you're trying to get a mucolytic effect, 1,500 to 3,000 milligrams a day. This is, and if you're really sick, a cold, flu, you can go that high upwards into that 3,000 range. If we're trying to just get good glutathione support, anywhere from 1,000 to 2,000 a day is a good place to start. So again, easy to take, widely available over the counter, and very, very powerful. NAC is one you're definitely going to want to put in your home remedy arsenal. Now next, let's talk about L-Tryptophan. L-Tryptophan is an amino acid as well, and its primary role, it's got a few, but one of its major roles is it helps your body to produce serotonin. It might help if I spell that right for you. There we go. Serotonin is a neurotransmitter that's predominant role, some people call it a happy neurotransmitter. So it plays a role in your demeanor. It's important though as well. From serotonin, we get something called melatonin. And of course, melatonin plays that primary role in helping us fall asleep at night. What happens when we have adequate melatonin and we go to bed at night, that melatonin shuts off the section of our brain that produces cortisol so that we can stay asleep and repair and recover, and we can convert serotonin into melatonin. So remember, tryptophan is the precursor to the body's ability to be able to do this. And so there are a number of studies that show that tryptophan taken between 500 and 1,000 milligrams per day can be an effective support for mood. There's some studies that show that there's a benefit for depression, those that suffer with depression. And if you think about most antidepressants that doctors prescribe today, what are they? They are SSRIs, selective serotonin reuptake inhibitors, drugs like Paxil and Prozac. And these drugs are antidepressants, right, used in order to preserve serotonin. So when we say selective serotonin reuptake inhibitor, these drugs stop the body from breaking down serotonin and recycling it. And so it keeps serotonin in the nerve cleft longer so that the individual can get a kind of a longer lasting impact or benefit of the action of serotonin. And so if you're looking at tryptophan as an option, it's also important to understand if you just start taking tryptophan and you're on one of these particular types of medications, tryptophan can enhance the functionality of an SSRI, and there's actually something called serotonin syndrome, which can make you sick. So it might be smart if you're on an SSRI and you're wanting to try to add some tryptophan. Again, tryptophan being a natural amino acid that you can get from eating protein predominantly, but you've all probably the Thanksgiving thing where people eat turkey at Thanksgiving, and then they get tired and want to take a nap. And this is one of the reasons why, is that there's a lot of L-tryptophan in turkey. Other meats contain tryptophan as well, but turkey predominantly one of the biggest concentration doses naturally. But again, if you're taking tryptophan to try to support your brain, your anxiety or your depression, and you're on an SSRI as well, you got to be careful, because the SSRI might start working too strongly, and then you can end up with serotonin syndrome. So my advice there is talk with your doctor. You know, if you've got a good doctor, they can measure your serotonin levels. So they can measure through lab. They can monitor your serotonin levels and make sure they're not going up too high and creating that. I've seen this a lot in my practice, where people come in and they're kind of playing with different amino acids. They've heard some of this information before, and they're also taking SSRIs, and we get their serotonin labs back, and they're off the chart and they're feeling terrible. It's because they've developed this issue. So you just want to be cautious that if you're going to start supplementing here with 5-HTP or with L-tryptophan, which is 5-HTP is 5-hydroxytryptophan. These two together, a lot of people will use to help with serotonin. If you're on an SSRI, just be careful. Now, there's some research I wanted to pull up here on this particular topic. You see the effects of dietary tryptophan on affective disorders. And so in this randomized crossover study, what they found is that those consuming more dietary tryptophan resulted in less depressive symptoms, as well as a decreased anxiety. So this study, small-scale study done on 25 young adults, found that people that ate more tryptophan in their diet, that had an excess of like I think it was 0.9 grams per day of tryptophan through their food choices, were less depressed and had less anxiety. So that's, you know, one very important aspect just from food. Food is very powerful, and sometimes people jump to supplements and forget the power of food. Don't forget the power of food, and this is why I mentioned earlier in the show, you know, all these people going plant-based, having a really hard time getting some of these amino acids in high enough quantities in their day-to-day diet, and they're suffering the repercussions of these deficiencies. And so, again, here's another research study on the association between dietary tryptophan intake and migraine. You see here in this study, our results showed that subjects who had a median intake of 0.84 to 1.6 grams of tryptophan per day had reduced odds of developing migraine by approximately 54 to 60% relative to those who consumed under a half a gram of tryptophan a day. So again, we're just talking about dietary consumption. We're not even talking here about the potential for supplementation. Now, again, with all these amino acids that we're going to talk about today, you can measure them all. I mean, you know, aside from just measuring serotonin, you can measure serotonin, but you can also measure directly. You can measure tryptophan. So, you know, this may be one of those things. If you're considering, you know, using some of these therapeutic amino acids, you might just consider having your amino acid levels checked. And again, get with your doctor. If your doctor can order them for you, great. If your doctor won't order them for you, you might consider using some of our online testing services, where we do a lot of this deeper dive on vitamins, minerals, and amino acids. Okay, let's next talk about L-Tyrosine. Now, tyrosine is super important amino acid. It produces, or it's a precursor to the catecholamine. So catecholamines being adrenaline, as well as noradrenaline. Some people call it epinephrine and norepinephrine, but also dopamine. So these are, you know, extremely important neurotransmitters. We look at the catecholamines here. These are, you know, important for your ability to tolerate and handle stress. They're, you know, so again, when we're stressed out, we make more adrenaline to help us cope and adapt to that stress. Adrenaline gives energy. Adrenaline helps with brain clarity. So very important that you get adequate tyrosine in your diet to support, especially when you're under more stress. And this is what a lot of times what we'll see when people, this is especially true of women, by the way, that when they're under tremendous periods of stress, their brain fog is one of the major issues that happens. They end up with a lot of anxiety. And this can be as a result of a deficiency of the ability to produce adrenaline and noradrenaline. And also as well, dopamine. Dopamine deficiency can cause those symptoms as well. Dopamine also plays a role in motor coordination. So that's muscles, how your muscles move and how well they're coordinated. We'll see sometimes people develop tremors. If you've heard of Parkinson's disease, for example, it's a disease where dopamine production is diminished as a result of inflammatory damage in the nervous system. But so muscle motor coordination, but also motivation. Dopamine, very, very important. So dopamine deficiencies can lead to depression, apathy, lack of motivation, lack of desire, drive to want to do much. And so again, you can't make these three neurochemicals without tyrosine. Tyrosine is the backbone of these chemicals. I mean, you need things like copper and vitamin C, to take tyrosine through this pathway. But again, L-tyrosine, very important in that regard. Now, L-tyrosine is also extremely important to produce thyroid hormone. As a matter of fact, the T in T4, so T4 is kind of an abbreviation. If you've ever had your lab tests done, your thyroid test done, T4 is thyroid hormone, right? So T4, the T is tyrosine, and then T4 has to be converted into T3, which is the active form of thyroid hormone. Same thing here, the T is tyrosine. By the way, the 4 and the 3 represent iodine. Those of you who are interested, iodine, also an important nutrient that plays a role in thyroid hormone production. But lack of tyrosine will reduce your body's capacity to make thyroid hormone. Now, super important if you're using tyrosine supplementally, if you plan on taking it and you're on thyroid medication. So if you're on thyroid medication, maybe you've got a hypothyroid diagnosis, Hashimoto's, and you're on meds and you're going to start taking tyrosine, one of the things that can happen is it can increase your T4 and your T3. And in effect, your medicine work better, in some cases, I would say, is it your medicine working better, or is it just nature helping you do what your body already knows how to do? Either way, you don't want to end up in a state where your thyroid, where your thyroid hormone is now too strong, it's too high. This can create heart problems, heart palpitations, night flashes, hot sweats, different types of symptoms associated when your thyroid medicine goes up or your thyroid hormone levels go up as a result of combining these two. So again, if you're thinking about using this, and you're taking the medicine, it's good to have a conversation with your doctor, monitor. Again, you can measure tyrosine before you even get started, but you can also monitor your TSH, your T3, your T4, what is called your reverse T3, and see what's happening with these numbers as you start this. Because again, this is just like I was talking about a moment ago with tryptophan and serotonin. It's that taking a lot of this can lead to more of this, which can make potentially for a toxic situation. So you just want to make sure when you add this in, you're monitoring. Now, as far as dosing is concerned, with tyrosine, 1,000 to 1,500 milligrams a day is a good place to start for an adult. Again, but if you're going to do that, testing something I would highly encourage you to do. So very simple to get L-tyrosine you can get it over the counter. I mean, it comes as a free form amino acid. And of course, you can also make sure that you're eating enough ample quantities in food, and where you're going to get the bulk of your tyrosine from your diet is going to be in animal meats. And so again, vegetarians, if you're avoiding all animal foods, animal byproducts, definitely I would encourage you to check your levels to make sure that you're not becoming depleted as time goes on. Okay, let's talk about L-Glutamine. L-Glutamine is an amino acid. We were talking about earlier, we were talking about cysteine or NAC, N-acetylcysteine. Well, glutamine is also part of what helps to produce glutathione. So I say glutathione earlier was NAC was one of the most important ingredients that go into producing that, but glutamine is also one of those important ingredients. So you need glutamine to make glutathione. Now glutamine is also very, very important as a fuel for immune cells. You know, most of the cells in our body require glucose as a fuel source to drive and generate enough energy to do their functions. Well, your immune cells can use glutamine as a primary fuel source. Now, what's also interesting here is that so can the cells of your small intestine. So your intestinal cells also use glutamine as a fuel source. We see this a lot where people have immune problems, where their white blood cell counts are low, they're not producing adequate quantities. We use L-glutamine, boom, white counts start to climb, they can start to go back up. It's because, again, glutamine can be used as a fuel source in the immune cells. Now, there's a lot of folks talking about using L-glutamine for leaky gut. And this is the reason why. The intestine cells, okay, need L-glutamine to generate or drive their energy production. And so if they don't have enough energy through glutamine, then those cells, remember, they have to turn over, they have to recycle every 2 to 7 days. If they don't have the fuel source they need, those cells get old, they become less effective at doing their work, and so we can get a breach of the intestinal barrier. So leaky gut can set in. And there are a number of research studies looking at L-glutamine with the barrier of the GI tract and looking at it for this very reason. So again, L-glutamine, very, very critical for the intestinal fuel, but also for immune cell fuel. Now, one of my favorite ways to use L-glutamine is in surgical trauma. It's like a fracture, broken bone, but also in workout recovery. So if you've ever had a surgery, especially major surgery like a hip replacement, you know, where they have to cut deep and there's a lot of blood loss, there's a lot of potential for damage during the surgery. Spinal surgeries can be the same way. Your body needs to recover and repair that. You know, surgery is basically scheduled trauma, right? So it's a form of purposeful trauma, just like a broken bone requires a lot of nutrients to heal and reknit and repair that bone. So when these two we look at as the same for recovery, L-glutamine supplementation can be very, very powerful. As a matter of fact, I used to run a rehab clinic for a number of years. We would use L-glutamine. We'd use anywhere from 4 to 5 grams in some cases a day of L-glutamine supplement to help patients recover. And you know, generally what we saw, and we did comparatives, we saw people that would do this would heal in the order of, you know, anywhere from 1.5 to 3 times faster than people who would not do it. So it's can be very, very helpful if you've had trauma or if you've had surgery. It's also very helpful for those of you who work out very aggressively and you're trying to find a way to reduce your muscle soreness, to improve your or reduce your downtime in terms of that muscle recovery. L-glutamine, even at the same dose, and you know, there's some studies that show that doses upwards of 30 grams a day are perfectly safe over long durations, although I would say be cautious with L-glutamine because you get the dose too high. Some people get headaches, some people will have diarrhea, so you know, this is relatively a safe range for most, but if you're going to go higher than that, just be cautious and kind of slowly, incrementally try to increase it, and if you start getting symptoms, you know to back off. But again, L-glutamine can be very helpful in this regard. Now, one of the things I want to point out, this is a great study just published a few years ago. You see here on glutamine, the role of glutamine in the complex interaction between gut microbiota and health. So in this review, again, the summary here, glutamine plays an important role in gut microbiota and immunity, increasing the production. One of its functions is it increases the production of something called secretory immunoglobulin A, or SIG-A. So those of you that don't know what SIG-A is it's a protein, it's an antibody that you produce in your mouth, you produce it in your GI tract, it's produced in your lungs, and what it acts like a handcuff. So it's a general non-specific antibody. You know, every time we eat, every time we breathe, there's chemicals and toxins in the food we eat, in the air we breathe. Well, the job of IgA is to bind those chemicals, those toxins, so that we can neutralize them. Like a handcuff neutralizes a bad guy. If a police officer is arresting somebody, puts them in cuffs so he doesn't have to fight them the entire way to the police station. Well, your immune system uses IgA, secretory IgA, as a handcuff of sorts to neutralize potential dangerous toxins and prepare them for excretion or expulsion out of the body. So you need glutamine to properly produce IgA, secretory IgA, as well as just pure immunoglobulin A. And you see in this case, they're talking about in the intestinal lumen, which again, in the GI tract. Also in the management of obesity, bacterial translocation and community. So one of the things that can happen in a gut, if the gut's leaking, let's make some room and let's draw. So if we look at kind of generally the gut, it's like a tube. And it's lined with cells. And if we have a gap in between these cells, that's what we call leaky, right? Leaky gut or intestinal hyperpermeability. Now, behind the gut wall, you have this massive conglomeration of immune tissue called the GALT, the gastro-associated lymphoid tissue. Inside the gut, you have all kinds of, particulate, bacteria, bacterial toxins, but there's one kind of toxin called LPS, lipopolysaccharide. When it permeates through, it will stimulate the GALT, but it will also traverse to your liver through the portal circulation, and it can damage the liver, increasing the risk for the development of what's known as non-alcoholic fatty liver disease. This is one of the ways that we can actually get fat stored in the liver. We can get pre-cirrhosis of the liver, just damage to the liver cells in general. And so what this is talking about here in this study is bacterial translocation would refer to bacteria crossing or translocating, right, coming from the gut lumen into the GALT and then subsequently on into the bloodstream through the liver, but also the toxins that the bacteria produces. So we could get LPS in there. We could also get different bacteria and other bacterial toxins as well, translocating across the lumen of the gut and then getting access to the bloodstream directly, leading to this chronic and systemic inflammatory cascade. So we know that glutamine plays a role in maintaining this barrier, going back to the point here. This study also discusses how glutamine affects the cytokines, so the different cytokines that are produced to regulate and modulate inflammation that glutamine plays a role in and plays a modulation role in. But also this also discusses the management of side effects during post-chemotherapy and constipation periods. So patients that have gone on chemotherapy, a lot of times they damage their gut, opening their gut up for this type of, again, translocation, and the importance of glutamine here to seal that gut back up to prevent some of that damage. So many of you may be out there watching this, getting treated for cancer, your post-chemotherapy, your gut's blown open, your immune system is reeling from the chemo, and you're trying to make a recovery. You might look at glutamine as a potential ally to help that recovery, to help support it. Okay, let's talk about L-Arginine. L-Arginine is another amino acid, and it's one of its major roles is in the production of a compound called nitric oxide. This compound, by the way, won a Nobel Prize in science for the understanding of how it regulates blood pressure. Nitric oxide helps with blood vessels. So again, you look at a blood vessel, it's a blood vessel is made out of a collagen outline and a matrix of muscle, right? And so this blood vessel will contract and relax. So it will open and it will close. It will open and it will tighten up. And so that vasoconstriction, vasodilation of a blood vessel in large part is regulated by this substance right here, this nitric oxide, which again L-Arginine is required to make. So one of the side effects potentially of L-Arginine deficiency when your blood vessels can't properly dilate and constrict is elevations in blood pressure, and we see that play out in a number of individuals, a number of research studies. So major role of L-Arginine is in that regulation of blood pressure. Let's talk about some of the research on this. So as we were talking about a minute ago, the blood vasodilation effect, and we talk about in this particular study published in the Journal of Sexual Medicine on the role of arginine supplements on erectile dysfunction. And so this was a systematic review and meta-analysis of a number of different trials. In this case, 10 different studies were looked at. The analysis demonstrated that arginine supplements with dosage ranging from 1,500 to 5,000 milligrams significantly improved erectile dysfunction compared with placebo or no treatment. P-value greater than 0.01 means that's an extremely statistically significant correlation, meaning arginine definitely works in this regard. So arginine supplements can be recommended to patients with mild to moderate EDs, kind of the clinical implication finality of this study. How many of you men watching this, you know, ever gone to your doctor? Maybe you don't want to talk about it on YouTube or in this video, but how many of you have ever gone to your doctor and instead of them saying, hey, let's measure your arginine, make sure you have the basis to produce nitric oxide so that your dysfunction is not necessarily being caused by malnutrition, or they just give you a pill, right? They just give you one of those pills. You guys know the ones, you know, the pills to resolve erectile dysfunction. And really, you know, it's the chemical manipulation versus the natural correction of a problem. I always like to go with the natural correction of a problem because the chemical interferences, the medicines, they don't come without their side effects. Here's another study on blood pressure. You can see the effects of L-Arginine supplementation on blood pressure in adults. Another systematic review and dose-response meta-analysis of trials. You see the effective dosage of L-Arginine supplementation was detected to be approximately 4 grams a day for systolic blood pressure. So 4 grams a day would lower systolic blood pressure independent of duration. Overall, arginine supplementation may be effective for decreasing blood pressure. Again, how many of you, guys or gals, have been to a doctor, your blood pressure is high, the first thing they want to do is put you on blood pressure medicine. They didn't test whether or not you were producing nitric oxide. They didn't measure your arginine levels, which again, this can be a cause. Remember, arginine is an amino acid. It's a nutrient the body needs in order to properly function. So this is why I always come back to nutrition, because if your body's not getting what it needs nutritionally, it will malfunction. In the case of arginine, that malfunction can manifest as erectile dysfunction and blood pressure problems. And so again, take the drug or figure this part out. It's easier to figure this part out, in my opinion. This study, the effect of arginine supplementation on the lipid profile. So another systematic review and meta-analysis. So guys, these are, you know, when I say systematic reviews and meta-analysis, this is a study on a conglomeration of all the studies to look at how effective something is therapeutically. And you can see in this meta-analysis concludes that arginine supplementation can significantly reduce triglycerides. TAG stands for triglycerides. So how many of you have had high triglycerides? You go to your doctor, your triglycerides are high. You know, that usually stimulates, even though the statin drugs, the cholesterol-lowering drugs don't affect triglycerides. A lot of times, if you have high triglycerides, your doctor wants to put you on statins. Don't ask me to try to explain that. I can't speak for why your doctor would want to do that. But point being, high triglycerides are a very real problem and a very real risk. If they're high, you have an increased risk for development of heart attacks and strokes and other cardiovascular problems, as well as fatty liver deposition. So the higher your triglyceride levels, the greater the risk you're going to deposit fat into your liver, thus compromising its ability to function and detoxify the blood appropriately, leading to all kinds of inflammatory problems. So again, arginine as a supplement, showing the ability for it to reduce triglyceride levels as part of its role in regulating fat synthesis or metabolism. All right, next let's talk about carnitine. Carnitine, very important amino acid. One of its primary roles is in this process called beta oxidation. Now, beta oxidation is the breakdown of fat into energy, ATP. So have you ever heard anybody use that term, ATP, adenosine triphosphate? We take fat through this process, break it down. What carnitine is it's the shuttle. It helps shuttle fat into the proper area of the cell to get to this beta oxidation point. So low levels of carnitine can hinder your body's ability to burn fat as fuel. Now where this might be important for you watching is if you're following a keto-like diet, especially those of you that are like doing keto green. There's a movement out there which is to go high-fat diet, low-carb, but also to reduce the quantity of animal food consumption. Remember, most of our carnitine comes from animal meats, carnitine, right? That word carn, just like carnivore, right? So we get our carnitine predominantly from meat. So if we're increasing our fat dramatically, but not getting adequate carnitine through animal meat consumption, then you could end up with a problem generating energy. And I've seen some people who do really, really poor when they're trying to go keto, especially again in this style where they get really lethargic, they don't know where their energy went, they have no get up and go. This could be part of the problem. So you might just look at carnitine, and you know, one of the simplest things is just test for it, right? Have your doctor test your carnitine levels. If they're low, you know, you can supplement, or you can change your diet a little bit, maybe incorporate a little bit more animal products that are rich in carnitine into that so that you're better at burning that fat as a fuel source. Now, carnitine has a lot of other different functions, and there are a number of studies that have come out on benefits of carnitine supplementation. In this particular one, published in Urology, they used carnitine as well as testosterone in the treatment of sexual dysfunction, depressed mood, and fatigue associated with male aging. So guys, pay attention. And what they found is that carnitines prove significantly more active than testosterone in improving nocturnal penile tumescence and International Index of Erectile Function score. Worked better than testosterone. So, you know, again, I keep saying this. How many of you have gone to your doctor, you know, with a symptom? The first thing you do is pull out the prescription pad. Here we have an example of something very, very natural and very available through your diet that might have the potential to impact you in a very positive way without having to grab for drugs. So again, conclusion here, carnitines prove to be active drugs. They're calling carnitine drugs, although I don't know that I would call carnitine drugs, but carnitine to be active drugs for the therapy of symptoms associated with male aging. So guys, are you getting enough meat? Are you getting enough protein? See this all the time, and a lot of my male clientele is they're coming in and their wives are trying to make their husbands go on a plant-based vegan diet, and their husbands are trashed. Their energy's low, they don't feel well. Again, sexual dysfunction, depression, and low energy. So if that's you, like, you might want to consider carnitine is dropped as a result of that diet change. So again, simple changes, big impact. Another study here on carnitine supplementation being favorable for markers of recovery from physical exertion in men and women. So, and these findings support our previous findings in youth that such supplementation can reduce chemical damage to tissues after exercise and optimize the process of muscle tissue repair and remodeling. So the takeaway there is, let's say you're working out on a regular basis, you're having a really hard time recovering, you're having a really hard time getting your body to repair appropriately. There's this potential for carnitine post-workout, right, to help in that recovery, to help reduce the potentiation of the damage from the exercise. So carnitine supplementation might be very indicated in those types of individuals. So I would be remiss if I didn't include a study on gluten. So you can see with carnitine in this study, carnitine in the treatment of fatigue in adult celiac disease patients. Well, first of all, what they found was that carnitine blood levels were low in untreated celiac patients. And this is a very common symptom or side effect of gluten on the GI tract. Remember, it damages the villi, leading to malabsorption. And that damage, of course, causes all kinds of nutritional deficiency, carnitine just being one of the many. But this study went on to find that carnitine therapy is safe and effective in ameliorating fatigue and celiac disease. So if you're gluten-free, think you're gluten-free, and struggling, you might want to look at carnitine. You might want to have your doctor measure the amino acid levels for you. Since L-carnitine is involved in muscle energy production, it's decreased absorption. So again, if you're celiac and you're still struggling, maybe your diet's gluten-free, you might want to have your carnitine levels measured and looked at because it might just help you with a recovery. Okay, let's move on to L-Lysine. Lysine, very important amino acid. It's commonly used as an over-the-counter remedy for herpes simplex viruses. Those of you that suffer with aphthous ulcers or fever blisters, lysine, again, a common ingredient in a number of those products. If we look at some of this research, I mean, the research goes pretty deep on this, but success of L-lysine therapy in frequently recurrent herpes simplex infection, treatment and prophylaxis. You can see this double-blind, placebo-controlled, multi-center trial using L-lysine for the prevention and treatment of recurrent herpes virus infection was conducted. They used 1,000 milligrams of lysine 3 times a day for 6 months. Now, the outcome was that the treatment group had an average of 2.4 less infections. Symptoms were significantly diminished in severity, and healing time was significantly reduced. L-lysine appears to be an effective agent for the reduction of occurrence, severity, and healing time for recurrent HSV infection. Now remember, what is herpes simplex virus? Now, what a lot of you want to realize is that the herpes simplex virus family includes chickenpox. It includes adult chickenpox, otherwise known as shingles. But it also includes people, again, that get recurring mouth sores or mouth ulcers. So if you're one that, for years chronically, periodically, you get just sores in your mouth, ulcers in your mouth, this is lysine. Lysine is your go-to. Again, in the research study, it was 3 grams a day was what was given. Now, what many studies also show, if you look at lysine in combination with things, so in combination with things like vitamin C, can be even more synergistic and even more effective. So if you're struggling there, you might just consider a lysine supplementation along with extra vitamin C and come back and see how well that does. Now, I've also seen a lot of people, not so much with shingles, of course, but with recurring mouth sores, is what works really well. And many of those cases, I've seen literally probably 1,000 reports of people coming back to me after going gluten-free saying, I no longer get fever blisters or mouth sores at all since I've gone gluten-free. Remember, gluten, if you're gluten sensitive, basically it's a pressure on the immune system. And why do viruses happen? Why do we get outbreaks of viruses? These are viruses that live in all of us. We all have inside of us shingles or herpes simplex type viruses. They're basically dormant, and they live in our DRG, our dorsal root ganglia, in the nervous system. And when our immune system takes a great tax or a great stress, those viruses can be activated, and that's when we'll pick up something like shingles, or that's when we'll get mouth ulcers. So big periods of stress, eating the wrong food, exposure to toxins can all be triggers for viruses that are dormant to become active, and L-lysine helps to prevent their activation. Now, I mentioned earlier, I didn't say this, but I want to say this. I'm going to back up a little bit because we were talking about arginine earlier, and one of the things I want you to understand is arginine. We said it improved blood pressure, and arginine can help with erectile dysfunction, among other things. But if you're taking high doses of arginine, it's going to impact your lysine. And I've seen cases where people were taking, especially men for like erectile dysfunction, taking high doses of arginine, start to break out with fever blisters, increase their potential chance of developing shingles. So if you're using high doses of arginine, just be very, very cautious if you have a history of herpes outbreaks. That it may not be the best move for you in that regard. But again, lysine can be very, very important in the viral realm of helping inhibit viral replication. So let's pull up this next one here. You can see the preventative effect of lysine on lysozyme glycation in type 2 diabetes. So just another important component to lysine that's been studied is that it was found to reduce the advanced glycation end products in the serum patients with type 2 diabetes. Now, what does that mean? Let's make that sound like English. We say advanced glycation end products, also known as AGEs. These are basically when sugar moieties attach to proteins in the blood. So what happens with type 2 diabetics, their blood glucose levels are high. That glucose interacts and it binds to proteins in the blood, forming these AGE compounds, these advanced glycation end products. These are the things that we believe contribute to dementia and vascular damage, increased risk for stroke and heart attack. It's one of the reasons why diabetes, is in that chain. And because of these advanced glycation end products. And so what this study is saying, again, is that lysine was found to reduce how many of these products occurred in type 2 diabetes. Now, they didn't elaborate, and I don't think we understand fully the pathway of how this works, just for clarity's sake, but we know that it does happen. So lysine, very beneficial for the reduction of age formation, or again, advanced glycation end product formation. These are the compounds in diabetics that increase the risk for a number of different diseases. So just another reason why lysine is going to be important. Now, at the end of the day, what's the take-home message? We've got all these different therapeutic amino acids. Remember, I only covered a handful of them today, but NAC, tryptophan, tyrosine, glutamine, arginine, carnitine, lysine all have tremendous benefits and potential impacts and effects. The take-home message is, number one, you got to make sure you're eating so that you can get amino acids. Again, there's a huge rhetoric right now that in order to save the planet, you somehow can't ever eat animal meat again, or you're murdering the earth. And I think that's a well, we won't go there. It's a false statement to make that statement. Humans need protein. Most of your amino acids, the vast majority of your amino acids, the vast majority of your what we call highly biological valued protein, which is the protein that contains the greatest concentration of amino acids, you got to get that from animal-based products. Now, if you're on a vegetarian diet or you have a religion where you are a faith, or just generally you're just an animal lover and you don't want to go in that direction, not judging, just simply trying to educate. If you're one of those, test your levels. Because I've talked a lot about, vegetarian diets causing, the potential for low B12 and low zinc and low B6 and other nutrients, but we haven't really tapped into this amino acid component. And I've seen this just a lot in people that go on vegetarian diets for long periods of time, is they're not getting adequate protein. And when you don't get adequate protein, remember what an amino acid is. It's the building block for protein. So you're not getting enough amino acids, then you run the risk of some major problems. Remember, amino acids, not all of them, but there are 10 essential amino acids, meaning your body can't produce them. You have to eat them. Most of these are found more abundantly in animal products than they are in plant-based products. So again, if you're plant-based, you want to test your levels, because if you're low in these different things and you're developing, high blood pressure, if you're getting sick on a more frequent basis, if your gut's blown open and you're trying to resolve leaky gut, whatever it is, it could be because you're deficient in one of these many different amino acids, and it might just be as simple as getting tested and supplementing. Again, if you're not willing to eat animal protein, supplementation is a possibility in today's day and age, and I just encourage you to look at this and to encourage you to do it if that's what your diet looks like. Now, those of you that aren't necessarily plant-based, you still want to have this looked at, especially if you're struggling with any of these symptoms on the list, because it might also, for you, your diets might also be too low in amino acids. So amino acids are very, very powerful. They often get ignored. Usually what takes all of the press are vitamins like vitamin B12 and minerals like magnesium, but many people forget about the power of amino acids. Don't be one of them. Now below this, I'm going to put a link to a number of these different amino acids that we talked about. If you're looking for gluten-free varieties or grain-free varieties, you can check that list out again below in the comments. I hope this was helpful for you. Make sure you hit that like button. And if you found it helpful, share it with your friends and family. Remember, our mission here is to help save 100 million lives, and I can't do that without you. Have a fantastic day. We'll see you next time. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.